Our good buddy Dr. Jason West on the line here with us this morning, talking about the reasons that a negative COVID test doesn't necessarily mean you're not infected. Oh, Dr. West, say it ain't so. Good morning.
Good morning. And wow, what a crazy time we're living in that now we can't even trust the testing. And that's what the media or the reports are, is just because you test negative doesn't mean you might not have it.
Yeah. Well, Dr. West, that's such a strange disease that it'll affect you if you walk into a restaurant until you sit down and take off the mask. Then you don't have any problem. And it won't affect you in a bar until after 10 o'clock. It's just amazing.
It is fascinating. And really, I think what the test is saying, or what this news article is saying, is that you just need to not get a false sense of security in doing reasonable things that are going to keep you healthy. I think it's just a really nice reminder. Doesn't mean that we have to, put our head in the sand and pretend that nothing's happening. But at the same time, from the very beginning, I've tried to tell everybody, get your immune system healthy. Go back to the basics of health.
Dr. West, that is something that most of the media, because they're too dumb to know, but most of the media, as well as some of the politicians, are not talking about doing the healthy stuff. My wife and I take massive doses of vitamin C and D3 and zinc and some other things, and we both tested positive for COVID, and neither of us had any symptoms.
Well, and I think that's exactly right. One of the narratives that I wish we were saying is millions of people are getting exposed. Millions of people are recovering from this. And the difference between people that are getting better and the people that aren't is their immune system. And doing exactly what you said, vitamin C, D3, zinc, healthy and alive foods, and getting all of that stuff lined up is your best defense. Now, the masks and the washing hands and the vaccine and everything, I mean, even the CDC says the vaccine in itself can't save us. It's all of the other stuff and the recommendations for the social distancing that are going to help us to beat this thing.
Dr. Jason West, integrative medicine physician, and about reasons that a negative COVID test doesn't necessarily mean that you're not infected. And doctor, we're still having all this problems of getting kids back to school. I loved Coach Lou Holtz coming out and saying, "Don't destroy my life by trying to save my life." Get these kids back on the athletic field.
It's fascinating. One of my patients called yesterday and was saying, in Arizona, they're having the kids play basketball with their masks on. And he was saying, is there any exemption that you can give my kid? And I'm like, well, I don't think so, because it's going to be a school policy. But again, doing the things that are reasonable, and then, it's like coronavirus came out and they said no one can get sick and no one can die. And no one wants anybody to get sick, and of course we don't want anybody to die, but that's almost like saying we're having a moratorium on life.
Yeah, isn't that the truth? Dr. West, you want to take a call from a listener?
Yeah, for sure.
All right. Morning, 947-1290. And good morning. Who's this? Okay, well, a case of phone fright there. Sorry, sir. So let's get rid of that. So what are you suggesting besides good nutrition and everything else? But let's get the kids back in school, for goodness sakes. The cure is getting worse than the disease. We've got a school board here that can't seem to figure out exactly how to do it, and we've got 450 teachers that say they don't want to go back to class.
Well, that's tough, because when it really seems like there's almost zero risk factor for kids going back to school. There is a little bit of risk factor for the administration and the janitorial teams and the teachers, because they're in a little bit different age bracket and some other things. And again, we just need to do our very best to be healthy, to wash our surfaces, wash the hands. Again, the mega doses of vitamin C and zinc, and then I think you got to go live your life.
Isn't that the truth? Let's try the call again. Good morning. Who's this?
Yeah, this is John Thompson. Just want to mention to you that the conversation about not getting vaccines from places like CVS or places like that, Savannah actually did have them at CVS and Walgreens and several others, and Kroger. But if you go online now, they say they're all in a pause.
Okay. Okay.
Well, you can't.
All right. Well. Let's see. Dr. West, what do you think about that? That some of these places had the vaccine and now they're having to stop or something. I don't know if they've run out or they have to prioritize them or what.
Well, I was listening to a news report yesterday on the way home from work, and there was a medical physician on saying, "Hey, wait a minute. We should be distribution of the vaccine the way that we normally do through the doctor's offices and stuff like that." And what's happening is the government outlet they're seeming to bypass the normal channels, and they're trying to and he just said it's not as streamlined, as efficient as it could. And so I don't know exactly what's happening with the CVS and the corner drugstores that we're offering it, but I am aware that there's some kind of hiccup in the process, and it was just one of those things where you want to say it ain't so.
Yeah, I know. And we talked about what they're with another reporter earlier said, well, maybe, but the fact that these vaccines have to be kept at these sub-zero temperatures, that could be one of the problems. They just don't have the equipment.
It's possible, and again, you want to do all of that, and one of the things that I'm telling people, and then you already know this, but one of the best things that you can do to prevent upper respiratory infections, which is the aerosol transmission of the coronavirus, is high 5 to 10,000 units of vitamin D, 10,000 units of vitamin A, getting enough sleep. And then, again, I think one of the best things we can do for this, which we hardly are not talking about right now, is washing your hands, because the soap helps to break down the fat layer around the virus.
Well, there you go. And we want to break down fat layers for everybody. Dr. West, thank you for your time. Always a pleasure, sir. Thank you.
All right.
Take care.
Bye-bye.
Bye.